Well, hi all. On behalf of Wolters Kluwer, a warm welcome to our attendees, speakers, and panelists, and a chief guest on the webinar on the occasion of World Anatomy Day 2024, organized by National Journal of Clinical Anatomy (NGCA) under the aegis of Society of Clinical Anatomists (SOCA) and Wolters Kluwer. Our topic today is advancing anatomy. We have very distinguished speakers today and panelists, for today's session. And we'll be taking all questions at the end of the session in the webinar. And I request you to please post all your questions in the Q&A panel of this event. We will try to address the maximum questions. Also, we'll be providing the e-certificates to all attendees who will fit the event feedback, form, which we will post it at the end of the session. So I request you to please provide your feedback via a link which will be posted in the chat section of the webinar. Now, to begin our session, and just to reiterate that we have some distinguished chief guests and speakers for today's session. As chief guest, we have Professor Nam Singh, who is the former director and CEO of AIIMS Bhopal. We have a speaker, Professor Richard Tunstall from University of Warwick, United Kingdom. We have another distinguished speaker, Professor Vijit Das from Sultan Qaboos University, Muscat, Oman. And we also have the distinguished members of a SOCA, Professor M. Sivakumar, who is the president of the Society of Clinical Anatomists. We have Professor N. Muthu Kumarvel, who is general secretary, and we also have Professor K. Satish Ravi, editor-in-chief of the National Journal of Clinical Anatomy. Along with that, we also have Dr. Rosemole, who is the host of the event for this session. Now, with this, I would like to play a video as prepared, shared with Dr. Ravi for the introductory session.
Mr. Shukla, I will just
I
will do the introduction and we'll continue.
Yeah.
Sure. Please go ahead.
Okay. So good afternoon, esteemed chief guests, guests of honor, distinguished dignitaries and delegates. Taking the blessings of the Almighty, I'm Dr. Rose, Assistant Professor, Department of Anatomy, Government Medical College, Thrissur, and Executive Committee member of SOCA. It's my pleasure to extend a warm welcome to all of you for today's webinar themed Advancing Anatomy. This event is organized by the National Journal of Clinical Anatomy under the auspices of the Society of Clinical Anatomists. Thank you for joining us as we explore the latest advancements in our field. I'm proud to say that this celebration has been organized by our society and the journal for over 4 years, marking our 7th webinar since 2020. Without a doubt, the driving force behind this successful academic journey is our dynamic editor-in-chief, Dr. Kumar Satish Ravi. Dr. Ravi is a globally recognized anatomist who has held various prestigious roles, including Professor and Head of Anatomy at the All India Institute of Medical Sciences, Gorakhpur, and Sub-Dean and Assistant Dean of Academics at this institute. He served as Course Director and Head of Anatomy at Spartan Health Sciences University in St. Lucia, North America, and is the Chief Editor of Snell's Clinical Neuroanatomy South Asian Edition, as well as the reviewer for Gray's Anatomy, the Anatomical Basis of Clinical Practice for the 2nd edition. Invited to join the International Advisory Board of the Lecture Atlas International Edition, he is also an active researcher, having received the Best Paper Award 3 times, the Young Researcher Award, and boasting over 85 publications in high-impact national and international journals. As a passionate teacher, he has been honored with the Best Teacher and Best Professor Awards for his contributions. Under his leadership, our journal has achieved indexing in DOAJ, Scimago Journal Ranking, and Scopus. Dr. Ravi has successfully organized 6 webinars, including an international one on publication aimed at training budding anatomists across the country. Thanks to his efforts, the NJCA is now globally recognized, attracting authors, editors, reviewers, and guest speakers from around the world. He is an excellent orator, has given more than 30 orations at national and international platforms. We are delighted to have you with us, sir, and I invite you to welcome our dignitaries and delegates. Over to you.
Good afternoon, one and all. Honorable Chief Guest, respected Good afternoon, one and all. Honorable Chief Guest, respected Professor Salman Singh sir, who is the former Director of All India Institute of Medical Sciences, Bhopal, President of Society of Clinical Anatomists of India, respect. Good afternoon, one and all. Honorable Chief Guest, respected Professor Salman Singh sir, who is the former Director of All India Institute of Medical Sciences, Bhopal, President of Society of Clinical Anatomists of India, respected Professor M. Shiv Kumar sir, General Secretary, respected Professor N. Muthukumar Vel sir, Treasurer Dr. Pushpa N.B. Madam, from the team of Wolters Kluwer, respected Mr. Ravi Shukla sir, all the esteemed senior anatomists participating in this program from across the world, and most importantly, my beloved budding anatomists across the country. I welcome you all to this academic event, and we are highly grateful to each one of you for giving your precious time. Ladies and gentlemen, it is a great honor to be among you today as we celebrate this World Anatomy Day for the 5th consecutive year. And this year's theme we have kept as Advancing Anatomy. This occasion not only highlights the incredible complexities of the human body, but also serves as a reminder of the clinical, or you say the critical role anatomy plays in our understanding of health, disease, and the practice of medicine. Now, the question arises, what is the importance of anatomy? What is the significance of anatomy? To my understanding, anatomy is more than just the study of structures. It is the foundation upon which the field of medicine is built. It is essential for our ability to diagnose, treat, and understand various medical conditions, or you say the clinical conditions. As practitioners, researchers, and you say the medical educators, we must continue to advocate for the importance of anatomical knowledge and clinical practices. Secondly, what the role National Journal of Clinical Anatomy is playing. I can say at the National Journal of Clinical Anatomy, we are committed to advancing this knowledge. Our mission is to disseminate high quality research and enhance our understanding of anatomical science. We strive to bridge the gap between basic anatomy and the clinical applications, fostering collaborations among researchers, educators, and clinicians. For this is the second year we are going to publish our special issue of National Journal of Clinical Anatomy. And this year, we have invited the research work from the area of neuroanatomical sciences. We humbly request you to submit your valuable research work by 31st October 2024. Now today, let us also take a moment to celebrate the achievements within our community. The innovative research being conducted and the advancements in imaging techniques and educational methodologies are paving the way for a deeper understanding of human anatomy. We are proud to feature these contributions in our journal, showcasing the brilliance of our contributors and the progress of our field. For me, the future generation is the most important. We must encourage the future generations. And as we look to the future, we must inspire the next generation of anatomists and clinicians. Education is the key, I feel, and we must advocate for robust anatomical education in our medical curricula and support initiatives that promote anatomy as a vibrant and essential discipline. By doing so, we ensure that the future healthcare professionals are well equipped with the knowledge they need to excel. I thank all the esteemed anatomists who participated in the National Essay Competition and National Journal Clinical Anatomy Cover Page Competition. Indeed, I was very glad to see the overwhelming response and enthusiasm of not only the budding anatomists, but the senior anatomists as well. And that's, I feel, it's a very, very positive sign. I won't take much time. So at the end, I encourage each one of you to engage with your colleagues, share your insights, and contribute and continue to push the boundaries of anatomical sciences. Together, we can honor the significance of anatomy in healthcare and ensure its legacy for generations to come. Thank you for your dedication, your passion, and your commitment to the field of anatomy. Once again, I wish you a very happy World Anatomy Day. Thank you. Thank you so much. Over to Dr. Roj. Thank you. Thanks a lot.
Thank you, sir, for your warm welcome address. Now, we have our esteemed General Secretary of SOCA, Dr. Muthukumar Ravel, to shed light on the activities of SOCA and NJCA. With 17 years of experience in various medical colleges, including Jipmer and Pondicherry, he currently serves as Associate Dean at Sri Venkateswara Medical College, Pondicherry. Dr. Muthukumar Ravel has previously held the positions of Vice Principal at Annapurna Medical College in Salem and Deputy Medical Superintendent at Sri Venkateswara Medical College. He is also the founding editor-in-chief of NJCA, which was established in Salem in 2012. As a visionary leader, he has been a strong pillar of support for our journal's activities. Over to you, sir.
Thank you, Dr. Rose. Are you able to hear me?
Yes, sir. Loud and clear.
Are you able to hear me?
Yes, sir. Yes, sir. We can hear you.
Okay. Good afternoon, all of you. I am very happy to be part of this World Anatomy Day 2024 celebrations by National Journal of Clinical Anatomy under aegis of Society of Clinical Anatomists, SOCA India, for the 5th consecutive year by the team of National Journal of Clinical Anatomy under Professor Kumar Satish Ravi, the editor-in-chief. Respected Chief Guest, Dr. Sarman Singh, who is former Director and CEO of All India Institute of Medical Sciences, Bhopal, Madhya Pradesh, India, and Person Director Research at Arbada Vidu Medical College, Pondicherry, India. Respected guest speakers, Professor Richard Tunstall from University of Warwick, United Kingdom, and Professor Srijit Das from Sultan Qubas University, Muscat, Oman. Respected President of SOCA India, Professor M. Sivakumar, and respected Editor-in-Chief of National Journal of Clinical Anatomy, Professor Kumar Satish Ravi, respected Treasurer of SOCA India, Dr. Pushpa NB. Respected Chairpersons of today's webinar, Professor Soumya Chakraborty from Nagaland University, and Professor Sohita Kaur from World College of Medical Sciences, Haryana. The host of the event, Dr. Rosemole, Executive Committee Member, Dr. Shivani Tingra, other office bearers, Executive Committee members, members and participants of this webinar, welcome again all of you. Wish you all fruitful time today. As you know, we celebrate this World Anatomy Day in memory of Angius Vesalius, 16th century anatomist, who is considered as father of modern anatomy. The Society of Clinical Anatomists, SOCA India, was started in the year 2011 for the welfare of MDMS qualified anatomists of India. Now we are having more than 2,500 members. The National Journal of Clinical Anatomy, NJCA, is the official publication of Society of Clinical Anatomists, SOCA India, which is indexed in Scopus and DOAJ and listed under SJR. Thanking Dr. Kumar Satish Ravi for all his efforts in indexing our journal. I thank the chief guest, Professor Saman Singh, the guest speakers, Professor Richard Tunstall, Professor Srijit Das, for accepting to be part of this prestigious event by NJCA and SOCA. As General Secretary of SOCA India, I wish grand success of this event, thanking Professor Kumar Satish Ravi, the Editor-in-Chief, and his team members, the Wolters Kluwer, our official partner, and its coordinator, Mr. Ravi Shukla, for organizing this event. Thank you, one and all. Thank you so much. Over to Dr. Rose.
Thank you, sir, for your insightful words. Now we have the president of SOCA, Dr. Shivakumar, sir, currently serving as Professor of Anatomy at Sri Ramachandra Medical College Hospital and Research Center. He has been the Professor and Head of Anatomy at JIPMER since 2010 with additional responsibilities as Dean at JIPMER Karaikal. Dr. Shivakumar has also served as MCI Assessor for both UG and PG courses and is a member of the Board of Studies for UG and PG courses at AIIMS Bhubaneswar and AIIMS Rishikesh. He has received the Dr. P.C. Bansal Memorial Gold Medal and Dr. Matilal Pan Memorial Gold Medal for a paper published in JASI in 2003. Additionally, he was the editor of the first South Asian edition of Clinically Oriented Anatomy by Kate Moore and is the author of textbooks of anatomy and physiology for general nursing and midwifery. I now invite him to share his thoughts. Over to you, sir.
Dr. Pushpa, should I start the session like the video?
Yeah, please share the PPT which I have.
Sure. Sure.
It's not audible. Please share the voice also.
Sure. I'll just do it.
Hello, Mr. Ravi. Hello.
Yes, ma'am.
Voice is not there. Please share the voice also.
Okay, ma'am. I think it's shared, being shared. Let me just reshare again. I think it should be there.
Yeah.
A very good afternoon to all. I extend a very warm welcome to our chief guest, Professor Sarman Singh sir, guest speakers, Professor Richard Tunstall sir, Professor Srijit Das sir, office bearers of SOCA and NJCA, and all the delegates to this webinar on World Anatomy Day celebration. 15th of October marks the anniversary of the death of Andreas Vesalius in 1564, who is considered to be the founder of modern human anatomy. The observations made by him overturned misconceptions in anatomy that had prevailed for centuries. He was professor of anatomy at Padua in Italy. He is considered as the founder of modern human anatomy because he taught that anatomy could be learned only through dissection. He opposed and corrected the erroneous concepts of Galen and fought against his authority, thus reviving anatomy after a deadlock of about 15 centuries. This day, which is celebrated as World Anatomy Day, provides anatomists with an opportunity to both celebrate anatomical advances as well as convey the need for more research and development in the field. About SOCA, SOCA was founded on 19th of July 2011. It was inaugurated on 9th of June 2012. We have more than 2,500 life members. We are conducting annual conferences regularly. So far, 12 national conferences were conducted. 13th conference will be held in Kashmir in May 2025. Regarding National Journal of Clinical Anatomy, the Society of Clinical Anatomy has got a journal called National Journal of Clinical Anatomy. It was started in January 2012 at Salem, Tamil Nadu, India, by the efforts of Dr. N. Muthukumaravel, who was the founder editor-in-chief of NJCA. He got the journal indexed in Index Copernicus International and InMed. Contributions of Dr. K.S. Ravi. During this celebration, I would like to acknowledge the contributions of Dr. Kumar Satish Ravi towards NJCA. Dr. K.S. Ravi, a man of excellence, once he took over charge as editor-in-chief, brought revolutionary changes. He reconstituted the editorial board. He included eminent anatomists as editorial board members and reviewers. Under his leadership, the journal got indexed in DOAJ, Scopus, and SJR. He attended the IFAA conference in South Korea and got global recognition for SOCA. We are honored by the presence of our chief guest, Professor Sarman Singh sir, who is an eminent academician, researcher, and administrator. Professor Richard Tunstall and Professor Srijit Das are eminent anatomists, internationally famous and expert in medical education. We are honored to have them as guest speakers today. I congratulate Dr. Kumar Satish Ravi, editor-in-chief of NJCA, and his team for their untiring great efforts for making excellent arrangements to celebrate this day in a grand manner. Thank you.
Thank you immensely, sir, for your inspiring words. On this special day, we are honored to have Dr. Sarman Singh, former director and CEO of AIIMS Bhopal as our chief guest. Currently, he serves as the Director of Medical Research and Institutional Collaborations at Arupade Veedu Medical College in Pondicherry, part of Vinayaka Mission Research Foundation. Professor Singh has made remarkable contributions to the field of medicine since joining the All India Institute of Medical Sciences, New Delhi in 1988. Rising to prominence as a full professor in 2007, he later became the director of AIIMS Bhopal, where he served until his retirement in 2021. Not only did he excel in research and administration, but he also established a Center for Translational Medicine and mentored the innovative MedSur Center at IISER Bhopal. A prolific author and respected mentor, Professor Singh has supervised numerous PhD and MD students, while his research on infectious diseases has garnered him recognition, including over 30 national and international awards. With a stellar publication record and accolades from leading academies, he has consistently ranked among the world's top scientists, reflecting his commitment to advancing healthcare through education and innovation. We are genuinely honored to have you with us, sir, and we warmly invite you to share your insights and words of wisdom. Over to you, sir.
Thank you, Dr. Rose. Am I audible?
Yes, sir. You're audible.
Thank you very much.
The voice
Sir,
clarity
your
is not there,
voice
sir.
is breaking. Voice is breaking.
Hello. It is better.
Ma'am, sir, a little bit better, but I really wish.
Good afternoon, everyone. Is that
Yes,
okay
sir.
now?
Yes, sir. Perfectly fine, sir. Go ahead, sir.
All right, all right. Yeah, thank you very much. So, distinguished members of the Society of Clinical Anatomists, President Dr. Siva Kumar, General Secretary Dr. Muthu Kumarvel, who is incidentally, we found out that he is in the same institute where I am working, and Dr. Kumar Satish Ravi, who is, we know each other for many, many years when obviously I was in him. So he is a very dynamic person. So we are all actually having lot many hopes from him, and he is very rightly, he is the correct person who is the editor-in-chief and who has brought this journal to this level, which you have already narrated. So I am really thankful to him because basically he invited me and I instantly agreed for this honor. So once again, even though he is not here, but thanks, Dr. Ravi. Thank you very much. And obviously on this occasion, I wish to congratulate today's guest speaker, Professor Richard Tunstall, who is from United Kingdom, and Professor Das, he is from Muscat, Oman. My warm wishes to Professor Soumya Chakrabarti. She is from, I think, I don't know. Sometimes in Bengal there are names, so Soumya, males and female both they have. But my, pardon for that if it is not that way. From Nagaland University, and Dr. Suhendra Kaur from the Jhajjar World College of Medical Sciences, Haryana. It is indeed my pleasure and honor that I am invited to participate in this conference, which is World Anatomy Day. This special day gives us a chance to recognize the incredible science of anatomy, which unravels the complexities of the human body, the basis of our existence. Anatomy, the study of the, you are all expert, but definitely the anatomy, the study of the structure and organization of the body has been a cornerstone of the medicine for centuries. From the ancient world to modern times, anatomists have shed light on the intricate design of our bodies, leading to numerous medical breakthroughs and advancements in the healthcare system. World Anatomy Day is celebrated on 15th October every year, and it was established by the International Federation of Association of Anatomists, that is IFAA, in honor of Dr. Andreas Vesalius, which member secretary and president, I think they have already covered. So I will not give much, time on that. But definitely, beside that, some anatomists like Herophilus, Raji, IBN Sina, and IBN Rust, they are also recognized, and their contribution is also very, very important. But definitely, most important contribution is of the Dr. Andreas Vesalius, who was born in year 1514 in Belgium and died at the age of 50. The most important thing is that at the age of 29 years, he wrote a book which is known as
It cannot be done like that.
Fabrica.
We have to trust us that we will select them.
Some people are talking,
Space wise. Space wise. 40 to नहीं.
Dr. Soumya, your voice is disturbing. Can you mute, please? Thank you. Thank you very much. So at the age of 29, why he is considered to be father of anatomy? Because at the 29 years, very few still, we have progressed and we have not many facilities, but 7 volumes of the book writing, and that was really something wonderful. And that record is still being held by him. So he was definitely the one of the best anatomists, and he was the one person who was appointed by the Royal Society, means Royal Family, as surgeon also, because his anatomy was so clear. But he was dedicated to anatomy, and even though he continued to work as a Royal Family surgeon, but otherwise, other than that, for not many years, he continued the surgery. And finally, he went to the family, went to the pilgrimage, and then there are some anecdotes that probably after returning from that pilgrimage, he was quite sick, and then he died at the early age of 50 only. So definitely, this encourages that people like him, they have contributed and they have made their impact. We pay our tribute to the pioneer in the field of anatomy, researchers and medical professionals who have dedicated their lives to advancing this field. Their unquenchable curiosity and unwavering dedication have expanded our knowledge of the human body, enabling us to diagnose diseases, perform life-saving surgeries, and improve our medical teaching. This year's theme, in India, we are having as Dr. Ravi said, the advancement in anatomy, but some of the universities, particularly I was reading University of Birmingham, they are having different themes. So this year they have made anatomy in motion, and they are organizing various kinds of family-friendly fun activities and workshops, and according to various levels. So that you can have various universities, they can have their own themes. Until otherwise, like many of the international things, they have unique and uniform themes. So that is definitely, either way, the anatomy in motion is also very good theme, and also what you have advancement in anatomy in India you have made, that is also wonderful theme. Nevertheless, as we gather today, let me take a moment to reflect on the importance of anatomy in our lives, particularly for medical students. I will come to that. It teaches us that every person is unique and intricate masterpiece, while also reminding us of the fragility and resilience of the human body. That is also very, very important. The anatomy transcends boundaries, cultures, the languages, and connects us all in highlighting our shared humanity through the remarkable commonalities of our anatomical structure. Nevertheless, we must also recognize the importance of continued research and education in the field of anatomy. As technology is evolving day by day, our understanding also deepens. It is essential to support and invest in this vital discipline. Through education and innovation, we will unlock definitely new frontiers in medicine and ultimately leading to improved healthcare, enhanced longevity, and a better quality of our life. On this World Anatomy Day, let us celebrate past achievements, honor our present contributions, what the people are making in the field, and look forward to the future possibilities that anatomy holds. Together, we can build
We were saying, sir, I think we have lost your video as well as the voice.
Yeah, because my light, in Pondicherry, this is a heavy rain, orange alert that, because of that reason.
Oh,
So,
yeah.
yeah.
But you are back,
But
sir. You are back. You are live
Yeah.
now.
Yeah,
Please go ahead.
thank you, thank you. So it greets upon entering the dissection hall. I also remember my old days on this day when in the dissection hall, when I did my MBBS from KGMC Lucknow, probably most of you must be knowing. So the topic, research topic was given to me was drawing the course of the memory arteries. So this day, I remembered my old days. I am delighted to learn that the Society of Clinical Anatomists is an organization of over 2,500 members. This is really, really very good. It is amazing number for a new society, which is not that old. It is equally impressive that the society publishes the research journal, and of course, under the editorship of Dr. Ravi, who is dynamic. I need not to say because the president and the secretary also, they have mentioned the journal is doing wonderfully well. And I think with that, I would like to conclude that I thank you all for your dedication to science of anatomy and for being part of this celebration of World Anatomy Day. May our collective efforts continue to pave the way forward a healthier and more knowledgeable world. I am happy to declare the event open. With best wishes, thank you very much. Over to you, Dr. Rose.
Thank you very much, sir, for your encouraging words. As a token of our gratitude, we would like to present a virtual recognition to you. Can you please take it? To enhance our celebration, we are delighted to welcome two brilliant minds, Professor Richard Tunstall, who will be presenting a guest lecture on using the evidence base to enhance clinical anatomy education, and Professor who will discuss preparing a scientific review tips and tricks. We are also pleased to have Dr. Soumya Chakravarti and Dr. Sohinder Kaur chairing the session. So before we move on to the session, I would like to introduce the chairpersons and the guest speaker to you. First, we'll start with the chairpersons. We are privileged to have Director Professor Dr. Soumya Chakravarti as our chairperson today. Dr. Chakravarti is the founder, director, and dean of the Nagaland Institute of Medical Sciences and Research in Kohima, where she has been instrumental in establishing various medical departments and programs. With a rich background in medical education, she previously served as the PBL coordinator and examination section head at BPKISS in Nepal, where she helped launch the country's first collaborative MBBS and MD program. She has also played a pivotal role in founding medical colleges in Kolkata and Bihar, significantly contributing to the expansion of medical education in India. Recognized for her excellence in the field, Dr. Chakravarti has received numerous awards, including the Global Teacher Excellence Award in 2020 and the Better India Award for Dissemination in 2024. Now it's my pleasure to introduce our next chairperson, Dr. Sohinder Kaur, Director and Professor of Anatomy at Lady Hardinge Medical College, New Delhi. With an impressive 37 years of teaching experience, Dr. Kaur has educated both undergraduate and postgraduate medical and paramedical students in gross anatomy, histology, embryology, neuroanatomy, and more. For the past 34 years, she has also specialized in teaching surgical and applied anatomy to postgraduate students across various surgical branches. Her PhD research focuses on the role of nuclear anomalies and DNA damage in the early diagnosis of cervical carcinoma. Dr. Kaur has numerous publications and contributions to her name, reflecting her commitment to advancing medical education and research. Let me move on to the guest speaker. Now it's my pleasure to introduce Dr. Richard Tunstall, Professor and Chair of Clinical Anatomy at Warwick Medical School in the UK. He is also the director of 2 innovative medical education companies and holds significant roles in education, quality standards, and examinations at the Royal College of Surgeons, England. Dr. Tunstall is deeply committed to enhancing national standards in clinical anatomy education and plays a vital role in quality assurance and training standards of international organizations and healthcare-related companies. His educational initiatives reach a broad audience, including undergraduates, postgraduates, patients, UK police, and team athletes. In recognition of his exceptional contributions, Dr. Tunstall and his team have received numerous awards for excellence in education. He is also an internationally recognized author. His book, Pocket Tutor Surface Anatomy, now in its 2nd edition, has transformed the way surface anatomy is conceptualized and taught, earning a British Medical Association Book Award. Additionally, he serves as an author and section editor for the thorax and surface anatomy sections in the 41st, 42nd, and forthcoming 43rd editions of the esteemed anatomical text, Gray's Anatomy. Please join me in welcoming Dr. Richard Tunstall, our guest speaker and the chairperson. Thank you.
Hello. Hello.
Thank you very much for the warm welcome. Happy World Anatomy Day and greetings from England, a very cold and wet England today. I'm going to talk to you today about the evidence base for education and how we can use this to enhance the clinical anatomy education we provide to our students. So I've just had an introduction, so I won't dwell on this, but I'm Professor and Chair of Anatomy at the University of Warwick. I also hold roles in examinations at the College of Surgeons, the Royal College of Surgeons, England, and I'm also a consultant to Von Hagen's plastination. So I develop evidence-based clinical anatomy training for healthcare professionals. And that's any healthcare professional, doctors, surgeons, physiotherapists, nurses, and so on. I'm also an author and editor, and you just heard this. I'm an editor or section editor on Gray's Anatomy, and we're just working on the 43rd edition, so look out for this. But I also have my own textbook, which is evidence-based surface anatomy, and I'll show you some of this a bit later on. So you might be asking, well, evidence-based what? What is evidence-based in education? Well, the evidence base relates to learning theories, learning processes, learning resources, and the actual information and data we give to our students about the position of anatomical structures, about how a certain artery might branch. So I'll start by asking you some questions, and you can reflect on these yourself. What guides your choice of learning approach or learning process? So what are you using in terms of evidence to guide this? Is your approach to learning or learning processes guided by the statement, well, this is what I have always done, or this is what we have always done, so we will keep doing it because it seems to work? Ask yourself, have you designed your clinical anatomy curriculum to optimize learning using evidence-based principles? So have you actually looked at the evidence base to see how you can make your learning better? And really importantly, are the resources and information used in your learning opportunities evidence-based? And finally, this is a very important question. So when I ask most anatomists this question, they always say, no, what I teach is not outdated. It's not outdated information. But my question back to them is, well, how do you know? So do ask yourself this question honestly. Do you use outdated anatomical information and data? And the chances are, if you use some current textbooks, you do, because the current textbooks often are stating non-evidence-based data that's out of date. So consider this. We as educators directly impact the learner experience. And that can be through our own beliefs, our own opinions, and our own prior experiences. So you were taught a certain way, so your students will be taught that way. We also impact our learners' experience because of our willingness to accept and apply evidence-based learning theory. So if we choose not to accept it, then we can actually have a negative impact on our learners. So over the next few slides, I'll just talk you through some evidence-based learning theories that really can and should be used to inform your approaches. And these are just some examples from the educational theories and practices that I use. So principle number 1. Which of these learning theories or models is most helpful for you when you create your learning opportunities? So when you create something for a student, do you think about taking a constructivist learning approach? Do you think about behaviorist, humanist, social? Do you think about Bloom's taxonomy? Do you think about several of these? Or if you know about these learning theories, do you actually find it quite confusing knowing, well, which one should I use? And the reality is that most educators find this confusing. However, there is help. Several years ago, some authors combined several different learning theories to create what they term the multiple theories model of learning. This is a very helpful model, as it provides a combined framework for the processes or stages that a learner must pass through as they learn. So the reference for this article is at the top. It's a Taylor and Hamdy paper from 2013. And this simple diagram shows to you the different stages a learner must pass through. Remember, this is a joining together of multiple learning theories. So our learners start in dissonance, where we and they challenge their existing knowledge, ability, or skill. They then move to refinement, where they seek out explanations or solutions. They then move to organization, where they begin to develop and restructure their ideas and information. They then get to the feedback stage, where we are very useful because they will articulate their learning and they'll test their learning with us, the experts. And then they get to the consolidation phase, where they need to reflect on their knowledge and learning process and think about what's next. So everything you design in your education curriculum and your learning opportunities should guide learners into this process and through the stages of this process. All teaching and curricula that I provide and my teams provide use this model, and it's highly effective. So principle number 2. We also use what's called the formative assessment-based learning process. And this learning process has been proven to enhance learning. And when I say to educators formative assessment, they just think it's a test. It's a test we give to students. But in this case, that's not correct. The formative assessment-based learning process is an active learning process that partners us as educators with our learners, and we go on a learning journey together. So formative assessment-based learning takes place in every interaction you have with a student. And here is a simple model with the references to it below. The formative assessment-based process requires learners to understand the learning outcomes they need to achieve, to then determine how close they are to being able to achieve those outcomes, and then to determine the next steps they need to take to achieve the outcomes. So when you teach and educate, your resources and your interactions can guide and drive this process. So the formative assessment process enables learners to continuously self-assess themselves and progress monitor themselves against learning objectives. Principle number 3. A lot of evidence now shows that didactic, information-rich teaching styles and resources are actually really ineffective at optimizing learning. So if you have students sit in a lecture for 1 hour and you're just telling them things, it's actually really ineffective form of teaching. And I've put a reference here that provides really hard evidence to support this fact. So in reality, you shouldn't be providing straightforward didactic lectures. It's best to actually remove those or modify them so you start to include active learning tasks. So to enhance learning, didactic teaching can be redesigned using that multiple theories model of learning and formative assessment-based techniques. Just think about how you can make your didactic teaching more interactive. Principle 4. Many of you educators will know about a picture like this, which is discussing the different learning styles people have. They can be visual, auditory, kinesthetic, and reading and writing. Traditionally, it was believed that learners learn best via a single style. And some of you may think this as well. So you might think, well, I'm a visual learner and I'm best at learning through visual media. The evidence actually now shows that the idea of a preferential learning style is actually incorrect. So people might think they learn best visually, but in reality, the evidence shows that they learn equally well through auditory stimulus, kinesthetic, and reading and writing. So for us as educators, this is really helpful because it means we should be producing learning opportunities and resources using multiple and varied techniques and methods which target the different types or styles of learning. And this will help our students to better conceptualize, visualize, and mentally process learning outcomes. So if it helps, think of your learning products like this UK pick and mix. If you don't know, pick and mix is where children go to a sweet store, there's lots of candy or sweets like this, and they just choose what they want because it suits them best. This is how your educational products should be. You provide learning opportunities and a range of opportunities for your learners to pick and choose, which will help them move through the learning process. So it's best to avoid using a single or dominant approach. So for example, if your main approach or only approach is dissection, well, that will suit some learners, but not all. You need to be thinking more broadly about what else could I provide that will help target learning styles and help students move through that learning process. So next I want to give you just some examples of how this could work in practice. And I'm going to talk a little bit about the medical course that I am involved in. We run a 4-year accelerated medical degree. We take 200 students per year. We teach clinical anatomy, so it's clinically applied anatomy. We have around 100 hours of face-to-face teaching with our students. That's where they come into our lab spaces and partake of different activities. You will see what some of these are. Our teaching and learning products, however, prompt our students into about 300 to 400 hours of learning. So even though we only see our students for 100 hours face-to-face, what we provide to them drives the learning process, and the extra learning they do that accompanies that totals up to 400 hours. We do not dissect, and we do not have classic lectures, and yet we turn out and produce excellent doctors who are well known in the UK for having a very good anatomical knowledge. Before I move on, I'd just like to thank and acknowledge my team. So this is my team at Warwick University, my 2 associate professors, Erin and Natalie, my 2 assistant professors, Crispin and Hossam, and Helen. And we're quite an international team. We have members from South Africa, America, Europe, and Sudan. So what I'm going to show you in the second part of my presentation is an overview of some of the activities that I give to my students at Warwick and relate that to the evidence base. So everything we do with our students relates to set learning outcomes. So we provide our students with a single set of learning outcomes for each week of teaching. This set of learning outcomes then relates to an ordered sequence of overlapping learning opportunities and events. So to give you an example, a certain learning outcome would first be covered by what we term watch it activities. These might be very short recordings to provide context and depth. It might include a short seminar or a video of me drawing something, and you'll see that in a moment. Next, the students would review the same learning outcome in relation to human tissue. They will also do it in relation to patients. And after that, they will move into what we call do it activities, where they are actually doing things like creating a model. So physically creating a model or drawing. And each week we provide this sequence of activities for the set of learning outcomes. So that's what we'll now look at, the evidence-based learning opportunities and processes that we use. So I've said already, we do not provide lectures to our students. That does not mean we don't provide them with resources where we are explaining a difficult concept or process, but we do this in a very different way. To help with the student's own learning style and to drive them into the learning process, we provide them with short recordings and accompanying resources. So this example here on screen shows, this would just be a PDF, an active PDF we send to the students. Here, this covers the eyes, orbit, and extraocular muscles. These 2 parts, each of them's 10 minutes in length. The students click this, it takes them to a short video, which is me discussing some complex concepts, but also talking to inspire the students, telling them why it's important, contextualizing this information to clinical practice. It lets me give the students guidance as to the depth and level of learning required. It also lets me review key concepts, and I signpost students. So I relate this to previous learning and future learning. And within these 2 recordings, there are questions. So we do not tell the students everything. We ask questions to drive the formative assessment learning process. And the students can access these questions via this link I'm indicating here. Our short recordings are not simply information delivery. We've thought very hard about how they can drive the multiple theories model of learning process. So this is a speeded up video of just a short seminar I provide on eye movements. Please be assured it lasts about 10 minutes normally. But this is me demonstrating with a model that the students will later explore how different muscles move the eye and then complexly how we clinically test them. So we do this for difficult and challenging concepts and then later let the students explore the same models themselves. The next recording is a draw with me. Again, this is speeded up, but we do short seminars where we draw live and we actually narrate over the top. This allows students to work at their own pace. They construct their own drawing at the same time as me. And later I'll just give you some evidence about drawing and how it's really important in the learning process. So here you can see it's talking about the different types of twins, how they occur, what frequency they occur, and so on. I've already said we don't dissect, but we do use human tissue. We made a deliberate choice to not have our students dissect because the evidence base shows that there are other ways in which students can learn from human tissue, and arguably some of these ways are more efficient and help the learners focus on actually what's important for clinical practice. So we use plastinated human tissue that's produced by von Hagen's plastination in Germany. So the images you will see here of plastinated tissue are from von Hagen's company. For us, realizing that clinical anatomy learning does not need to rely on traditional approaches, such as dissection and wet specimens, was actually really liberating and freeing. It allowed us to think very differently about what we give to students and how they learn. So our students will interact with many different plastinated specimens. And I often get asked, well, if the students aren't dissecting, how can you promote learning because they're just looking? I also get asked the question, well, your tutors in the human tissue sessions don't teach. None of our tutors teach. We do not stand there and tell our students things. We actually train our tutors to use the formative assessment process. They're trained to actually figure out where a student is in their learning, and then they ask questions and provide guidance to move them on using the human tissue. So every student interaction with our plastinated specimens is accompanied by questions, tasks, and things that drive application to clinical practice. So here's an example. The students are provided with a workbook for each region of anatomy. So in this example, it's just one station from the workshop covering intercostal spaces, diaphragm and breathing. Now, of course, we want the students to look at the structure of the chest wall. They will relate that to the plastinate. But then we also ask clinically applied questions, which tend to be in grey boxes. So here it's getting them thinking about, well, if I need to access the thorax, what layers do I go through? Which structures do I need to be careful of? Oh, and later we get them to identify the landmarks for safe access positions on the thorax using a patient. So whenever students are with us, using plastinated tissue and other resources allow us to provide multiple views of the same region and structure. And this helps students very quickly build a mental picture of the anatomical structure, its blood supply, its relations. So here you can see a beautiful kidney specimen with blood supply and with the suprarenal glands. Here you see a different abdominal dissection where we're showing to the students the position of the kidneys, the retroperitoneal position, but also now introducing some of the relations. This is a unique view where we've got a posterior view of the kidneys and their relationship with the diaphragm and lungs. And this is the beautiful thing about this type of resource. It allows us to show students views you don't classically see when you dissect. But this helps them to quickly understand that a posterior relation of the kidney is the diaphragm and it is the lung. We also use plastinated cross sections as well. And of course, we relate that to medical imaging. So using this type of resource, the silicon plastinates, has allowed us to deeply integrate that resource into many different learning opportunities. And these learning opportunities overlap. So students will see the plastinated tissue in the lab space, but then later or the week after, they might see the same specimen next to a patient. So they can then relate that anatomy to the patient. And this is helping push them through the learning process. So all of our tutor interactions use the formative assessment process. So this is really important. So Jitendra here, one of our surgeon tutors, isn't teaching these students, he is asking them questions to help them realize where they are in the learning process. So something else we do with our students is hands-on clinical surface anatomy. So I think it's fair to say that many anatomy courses include little or no dedicated time for surface anatomy teaching and learning. They kind of expect students to just understand where structures are. But arguably, surface anatomy is the most used type of anatomy by clinical practitioners. We always see patients with their skin on. And we find that surface anatomy provides an alternative way for learners to visualize, position, and mentally manipulate in their head anatomical structures. So it's another way for students to test their learning. So it's good practice to ensure learners are provided with evidence-based surface anatomy. And the reason I say this is that much of the surface anatomy in some of the classic textbooks is not evidence-based. It's actually outdated. So talking about the evidence base, that's my next point. Our teaching always uses evidence-based anatomical information. And when anatomical information is evidence-based, it will often present, for example, an average position, and then the range associated with that. And on each of these diagrams, so on the left, the axillary nerve, center radial nerve, and on the right, the safe positioning for lumbar puncture, but also where the spinal cord terminates and the range of that. This is all evidence-based. You can see there's a range and a zone. So traditional surface and positional anatomy is based on cadaveric studies, and it often ignores variance. So how much use is that then to our students? And in a publication in 2010, Hale and his colleagues actually said this. They said, if surface anatomy, I've changed this because it should say, if anatomy is not evidence-based, it will rightly be perceived of limited clinical value. So if we're not teaching the evidence base, then it's not much value in clinical practice. Here's a good example I've used several times. The vertebral levels of structures passing through the diaphragm. Now, classically, when I ask students this, and I ask anatomists this, they give me this answer. T8 for the inferior vena cava, T10 for the esophagus, and T12 for the descending aorta. Guess what? Most of this is wrong. It's outdated and it's based on cadaveric studies. The evidence base shows to us, this is CT evidence, shows to us the inferior vena cava passes through the diaphragm most often at upper T11, the classic positions given in brackets just to the right. The esophagus passes through at lower T11 and the aorta at T12 or upper T12. And the diagram on the left of screen shows to you with the blue dot, the black dot, and the red dot, that average position. The arrows show you the range of positions. So we should be telling our students this information. This is the correct information, and we should be training them to appreciate variance. So with the evidence base, what we can do as anatomists is look at the data, look at the research, bring that data together and provide our students and our publications with an aggregation of this data, which allows us to position structures within zones. This diagram is from Gray's Anatomy, 42nd edition. I produced this diagram to show the range of positions in which, for example, number 3 here, the temporal branches of the facial nerve sit, or number 5, the parotid duct, or number 7, the marginal mandibular nerve, or number 9, the very classic accessory nerve. And notice the white box shows the range of positions. So the reason we need to do this and to help our learners practice this knowledge and apply this knowledge is we want to help them build a mental map of the body to reduce the chance of errors such as this. This practitioner is about to put a chest drain in at this position. This is completely the wrong position, wrong landmarking, and the reason is they haven't practiced or exercised this evidence-based knowledge. So final few resources or practices. Our students also explore cross-sectional anatomy, but not just medical imaging. They will explore human tissue cross-sections, again from von Hagen's plastination. And the detail on these is astounding. Students don't need to know all of this detail, but it helps them to understand and recontextualize the position of structures and the size of structures within the body. So a question to you, in your teaching, are you using anatomical cross-sections? If you are, why? If you aren't, why not? Why would you not use these with your students? Of course, they directly correlate with cross-sectional medical imaging. And here's a beautiful example of a cross-section through the anterior abdominal wall, just where the pointer is here, and the proximal part of the thigh. And what this beautifully shows, if you can see the red laser pointer there, it shows a layer of fascia, this being Scarpa's fascia, crossing over the inguinal ligament and beginning to blend with fibrous webs into the fascia lata of the thigh. We teach students this, we tell them this, but they don't often see it with this beauty and this clarity. So the cross-sections can help to clarify clinically relevant anatomical concepts. And very importantly, students interacting with multiple representations and views of anatomy helps them to rapidly build a mental map of the body. And that's a mental map of the positions, shapes, sizes, and relations of body structures. So some of the benefits of cross-sections are they show undissected, undisturbed anatomy. They show layers, tissue planes, and depth. They do have a slight 3D effect, which really helps students' learning. They, of course, correlate with medical imaging. We find they accelerate visualization and the learning process. And they sit at this interface between the macroscopic anatomy and microscopic anatomy. So what we're finding is students find it easier then to begin to visualize histology. Our students also, later in their learning process, will create and explore conceptual models. So our students do this every week with us. They will do human tissue teaching for a while, and then they will go into a different area and they will create models, many of which we have designed. So the model you see on screen here is actually a model that's designed to teach the omental bursa or the lesser sac, a really challenging area. But we teach this to our students in week 1 and week 2 of their medical degree. And we now have beautiful dissections and models, which means students just simply understand it. They can conceptualize it. There's a lot of evidence showing that the construction and exploration of physical models is a vehicle for generating mental images of structures, and it does this via exploration and manipulation of multiple representations of an object. So in other words, if you let your students explore and create models, they're going to learn anatomy better and likely quicker. Another publication showed that learner exploration of real models improves learning in both high-performing students and low-performing students. So do not think of this as a simple activity. Model creation actually helps learning at multiple different levels. So finally, guided drawing tasks. We get our students drawing every week. We don't expect Da Vinci type drawings. We actually just want them to do simple line drawings, and we do a guided set of drawing tasks for them. We might sometimes, as you could see on screen, provide a base image, and then we provide instructions for the students on what they draw. So they follow instructions. This helps them to test and build their knowledge. So importantly, drawing requires learners to synthesize, apply, and commit their knowledge in a permanent form. So if I say to a student, oh, tell me the branches of the abdominal aorta, they might be able to name some branches. Then I say to them, draw it. And it's a completely different skill because they're having to visualize, apply, and then commit in a permanent form. This process drives them through that learning cycle. The evidence for drawing is strong. It helps students to externalize and self-assess their understanding. It helps students to integrate new and existing knowledge via the activation of mental models, so things they are thinking about in their head. It helps students to increase their spatial cognition using visual cues, and it promotes discipline-based thought processes. It's exactly what we want. We want students to be thinking about the relevance of anatomy to clinical practice. So hopefully within that, I've helped you just to generate some different ideas or thoughts as to how you might begin to enhance your anatomy curriculum. Remember, using the evidence-based will enhance student learning. You as educators should try providing multiple, overlapping, and varied learning opportunities. So if you look at your anatomy curriculum and think, well, my students only really dissect, then start to introduce some new activities. So drawing's a good example, or the model creation. And remember, the multiple theories model of learning is really an excellent guide. It's a guide for students so they can understand the process they'll go through and how they feel. And it's a great guide for you as educators. because you can start to think about how your learning resources and curriculum help students through the process. Looking at it this way will also help you to identify deficits in your process. So remember, evidence guides what you do and what you provide. Trust the evidence base when it comes to education and when it comes to anatomical knowledge. Many thanks for your time. I will finish here.
Thank you, sir, for that brilliant session. Now the floor is open for discussion. I request the chairpersons to lead the discussion.
Thanks so much, sir, for your eye-opening session. Thank you very much.
You're very welcome. Thank you.
May I request the chairperson?
Are we taking questions?
Yes, sir. We are waiting for the chairpersons to respond. Sorry for the delay.
That's okay, no problem.
It was amazing. Audible?
Yes, ma'am, you're
Hello.
audible, but the voice is breaking.
It's correcting because, there are mountains. Dr. Richard, if,
Soumya, ma'am, sorry to interrupt. Your voice is breaking.
base and how we can really club the cognitive with the skills which are essential. And right now we are concentrating on the silicon plastination and other methods, but I was also interested if we could have included 3D bioprinting also, provided, because you also said that there are other means for it, and there is no dissection and no classic lectures, and a single set of learning outcomes cover a week of learning. It was amazing in that way, and I would appreciate to know if we can also club the 3D bioprinting into the system, because everybody in India is now into silicon plastination, and as you have shown, how we can include the 3D bioprinting in anatomy. We are trying to do that here, and my question is, can we include this also in the evidence-based anatomy? Sir, over to you.
Thank you, and thank you for your question. I didn't hear the first part of what you said because your voice was breaking, but I've heard the latter part in your question. The system I presented and the learning theories I presented are very flexible when it comes to the type of resource and learning opportunity you give to your students. So what that means is that if you still dissect at your institute, that's fine. But the evidence shows that dissection should be just one part of the learning process. So alongside that, you should be including other activity types. And as you've said, the 3D printing, research in 3D printing and the use of it's increasing. That might be through man-made materials, or it could be bioprinting. Those are valid resources. What you need to think about is, what are you asking the students to do with that resource? And how is it relevant for their practice? Because if you want them to interact with the resource and pull it apart because it's model exploration, then of course that's good. If you think that students interacting with those models will develop surgical skills, well, they probably won't, because surgical skills come in postgraduate training. So what I'd say is, any resource is worth considering. You just need to think how it drives student learning and what the benefits are within that learning process.
Thank you, sir. Thank you. Thank you so much. Over to you, Rose.
Okay, once again, thank you, sir, and thank you, ma'am. Hope we don't have any more questions. Okay, with that, we have one more session coming up with Professor Srijit Das. We are honored to welcome Dr. Srijit Das, a distinguished academic from the College of Medicine and Health Sciences at Sultan Qaboos University in Muscat. With over 30 years of teaching experience, Dr. Das has made significant contributions to the medical field, including 555 indexed publications and an impressive H-index of 38 in Scopus. He has held prominent positions as a senior resident at AIIMS in Delhi and as an associate professor in India and Malaysia. Dr. Das is a fellow of the Royal College of Surgeons in Edinburgh and serves as an associate editor for multiple medical journals. Recognized as one of the top scientists in medicine by Stanford University, he is also an inspiring motivational speaker and has been invited to lead workshops on manuscript writing across several countries. Over to you, sir.
Good afternoon. Is everything clear on the screen?
Yes, sir, it's clear.
Yes.
Thank you, organizers. Thank you, Chairperson. And thank you, especially Professor Ravi, who invited me for this talk. And I believe that after this talk, I will have collaborators from the participants who can join my team also in writing reviews. So the first and important thing here is, you have to introduce yourself. You are from where, what is the level of study you are doing, and what is the research interest. These days, we are crippled with the financial situation in many of the institutes. The only hope here is to publish something with the least resources available. And when you go for a review, that is the easiest way to publish. But at the same time, reviews are solicited from well-known authors, from well-known people who are in that particular field. So I will narrate the experience here on different types of reviews, and you can get to know the things which are needed. First of all, why these publications are important. The most important thing is everywhere now they're looking into these key performance indicators. So at the end of the year, your assessment is done on the KPI. And every scientist has to communicate what he or she is doing. The science has to advance and you leave a legacy. So a lot of efforts are being given to showcase your results. And believe me, writing a review article improves the skill of the postgraduate student or a young lecturer who knows how to surf the literature, develop the critical thinking. So you learn about a subject, you read and write, and the students and the postdocs, they also have a KPI when they go for the Viva. Many of the universities, they are strict in the sense that these students have to come out with requisite number of publications. Then only they can appear for the Viva. And departments KPI is also one of the important things which will help you. So we discuss about the reviews. What are the different types of the reviews? And especially what is a systematic review? What is the difference between systematic and scoping review? What are the standard reporting guidelines needed for the systematic review? And which one you should use it? Do you need to register or not? Can you publish your protocol, the protocol of the systematic review? And what are the resources which you need? So we'll be dealing with all these things. So as you see here, the types of review which are shown here: systematic, meta-analysis, and meta-synthesis. First, starting with the narrative review. This is one form of review. So what you do is, you have a comprehensive background and there is a particular field. So you highlight the significant new research, what you're doing. For any manuscript which I am reviewing for any anatomy journal, I will see the last paragraph of the introduction section. Be it a review, be it an original article, that last paragraph of the introduction section should highlight what is the research gap, how you have identified those research gaps, and how do you aim to bridge those gaps. And that actually justifies your research question. Many people say such has not been done. It is the first time they are doing in particular geographical region or any other area. That may not be a good scientific fact. You have to tell what is the outcome from that. That means the output. Now, in a narrative review, the problem here is there is no specific criteria for what articles you are including. But these days, reviewers have started asking how those articles were picked up. Did you have anything in mind while searching for those articles? So they are also raising questions in this section of narrative review, which may not be pertinent because here the question of bias is there. That is the reason when there is a bias, so you expect those people who are experts in that field, they only are good enough to select those topics and give their opinion. So I share with you, this is one of the narrative reviews which we wrote. Our team was quite big enough and the majority of the authors are from Malaysia, and it was published in a high impact factor journal, which you can see lower down. That is Trends in Food Science and Technology. It is a quartile 1 journal with impact factor of 7.9. So this journal, usually it will not welcome narrative reviews from any author unless there is prior communication between the editor and that author. So we do some homework, we interact with the editor, then we say that we are going to write this narrative review, and these are our components. These areas we discuss in detail. And then he says, yes, then we go ahead. So usually if we write a narrative review and straight away we send it. High impact factor journals, they may refuse. This is one of the narrative reviews which we published in Frontiers in Medicine, another quartile 1 journal. So here also we interact with the editor first. And if you see the number 3 author, that is Kok Yong Chin, he is one of my junior colleague from Malaysia who is an expert in writing different types of reviews. So he's in my team and we write a lot. And majority of the things which are projected in today's slide, they are from his presentation. So he's an expert. I share with you the latest narrative review which my students have written. And these are all final year students. And this is a quartile 1 journal, which is Current Medicinal Chemistry. This is early online. It has not come in print till now. So this is the aspect of miRNA and the bone tumors. A lot is being done on this miRNA because they are helping in prognosis and also diagnosis of any disease. So how you can develop more, and the drug delivery, drug design can be done on the basis of this miRNA. So these type of topics which you pick up, which are hot topics, and it helps in the diagnosis, prognosis, better outcome, treating the resistance, especially in the cancer, the chemo resistance, they will be always a hot area for publishing. Now, pure anatomy, teaching and learning. So this is what we do in our department. We form a team, those who are interested. Then I will make the template. Individual lecturers will pick up which part to write. A deadline is given. And at the end of the day, we send it. And this is another Q1 journal from Switzerland. And this is entirely on the teaching, learning, and assessing anatomy with AI. So this was published 2 years back. AI is going, a lot of work is being done on AI. So how you can incorporate that AI in anatomy teaching? And we do the critical thinking. We dig out the literature, and then all the anatomy lecturers, they chip in with their views. And I, as an editor, I do the last editing. We send it, and then we get it accepted with major revision. Now writing a systematic review. So the first thing which Professor Ravi, he asked me last time, sir, can you emphasize more on the systematic review? I said, yes, and this is one of the most difficult things. So the purpose here you have to know for the systematic review. So a list of studies will be available, and then you have to critically evaluate, synthesize all this, and there is a particular time frame. That means from which year to which year, which methods you have used for the search, how did you evaluate, how did you synthesize, and the research question should be very clear. What was the criteria for inclusion, exclusion, then what type of literature you accessed. These are all the key points for systematic review. You can see here on the left side of the screen, this is a journal which is Q3 from Malaysia, and the topic here, because they have bilingual, so you can see in Malay as well as in English. All the authors except first and second, we are the lecturers, and the rest are the students. So we were permitted to have our names as lead author. Usually I won't take it, but we did a lot of work here to filter out the literature, and there's a reason we took up as first and second authors. The last author is also a lecturer. The students were taught how to do the systematic review. And on the right side of the screen, you can see this is a Prisma chart. So Prisma chart is one of the essential components when you are doing a systematic review. If you follow this Prisma chart, the editor of the journal, he or she will be convinced that you have followed the proper steps. So I believe everyone knows about this Prisma. So this is a must when you are doing a systematic review. Now we also do quality assessment. On the left side of the screen, you see how this quality assessment is done. And on the right side of the screen, you see the evidence table. Now, these are not easy tasks. They require a lot of time. And that is the reason why in many of the universities, systematic reviews are taken as a research project. Now coming to the meta-analysis. So if you see on the left side of the screen, you have the level 1, 2, 3, 4, 5. So you have the evidence which is shown as the example what you are doing in the level 1. So it is just meta-analysis of this homogeneous RCTs there. Level 2, that is heterogeneous level, evidence prospective comparative study. Level 3, evidence case control study or retrospective cohort. Level 4, uncontrolled cohort studies or case series. 5, expert opinion case report, personal observation. And foundational evidence, that is animal research. So you do a lot of statistical analysis in meta-analysis. And many people use different softwares also. So you have to be aware that statistics plays an important role here. Review Manager is one of the, again, the software which you will use, and there is something called RevMan under Cochrane. So that is also a tool which is used for systematic review and meta-analysis. So Cochrane is now owned by Wiley Publishers. So many of the universities, they have tied up that you can also bring the experts from Cochrane to your university to train the youngsters. So back in Malaysia, they have some of the universities, they have the agreement signed with Wiley, and they can have their researchers trained for systematic reviews and meta-analysis. So what are the other elements in systematic review? So if you see here on the right side of the screen, there's something called forest plot, something called the forest plot. And these are done in systematic reviews and meta-analysis. These are quite difficult things which people have to learn. Now, the other aspect is you have to interpret the findings in such a way that how the outcome can be beneficial. So the common core elements, themes, they have to be isolated. The new conceptualizations and interpretations, that's very important. Now, to share with you very interesting thing, a doctor went to a cardiologist and he had some problem with his blood pressure and all, and also the cholesterol level. So he was discussing with the specialist, the cardiologist, whether to start the statin or not. And the cardiologist also said, no, let's wait. You take some precautions, and after a few months, we see what is happening. And after a few months, this is the same cardiologist who says you can start the statin now. And he says that his advice is based on the systematic reviews which have come up in some high impact factor journals. So you see now there are many medications which are used based on their outcome from the systematic reviews. So here you see there is a systematic review and meta-synthesis. That is one of the articles which they have published here. And they show few of the details. So here the forest plot is replaced by the thematic analysis. So that one you can see on the right side of the screen. Now coming to another type of review, which is known as scoping review. So you map the key concepts in a research area, and then you have the main sources and the types of the evidence, and you have the synthesis and analysis. A specific topic is there, and you have to provide the clarity. So once the mapping has been done, so regardless of study or design and depth of investigations, you go on, and this is very much similar to a chapter 2 in a thesis, I would say. So if you have a look at the scoping review, just hold on. That is an example of a scoping review, which myself and my team from Malaysia, we wrote it. And this is a publication in the journal, Asia Pacific Journal of Clinical Nutrition. So this deals with this postpartum depression. So a scoping review abstract is being shown here. The article has 9 citations to date. It was published in 2021. So what are the differences? We are not talking about the differences between a scoping review and a systematic review. So if you look at the nature, scoping review is explorative. Systematic is validation. You validate all the outcomes. Research question in a scoping review is broad. Systematic review is very much focused. Scoping review requires more than one person, yes, and also systematic reviews, because in systematic reviews, different authors will do different tasks. And then if there is any discrepancy in their observation, a third person will chip in. Quality appraisal is not necessary in scoping review, so it becomes a bit easier. But in a systematic review, best evidence is required. Types of study. In a scoping review, you can go any extent. That means there is no particular time frame or the year. You can just pick up any study. Systematic reviews. Now, human studies, usually we do not go for animal studies here. The human studies observational and interventional aspect, that is very much looked into in systematic reviews. But in systematic reviews, you also have anatomy articles now. I saw a recent article on the variations in a particular geographical zone, how many publications were there in the field of variations. So that's quite interesting. So the research question in a scoping review, all this search protocol, evidence table, insight to the data, they are all covered in the scoping review as well as systematic review. So that is a similarity between these two types of reviews. So this is the Prisma chart, the main checklist when you are writing the systematic review. First of all, you have to have a title, then the abstract, and then introduction based on this rationale, objectives, methods on the eligibility criteria, information sources, search strategy. All these are important. So the Prisma guidelines should be complied. Now, this is very important. You have to register when you are going for a systematic review or meta-analysis. What is the reason, the purpose for registration? So you can reduce the bias and the transparency also increases. Say, for example, from your institution, you are doing a systematic review on a particular topic. Now there are a group of researchers after 1 year, they want to have a similar topic. So if you register, some of the institutes, they register, and if they register means they will look into this aspect that the same topic is not repeated, just say within 1 year or 2 years. So that helps. Unintended duplication, that is what the journals, they want, that it should be registered either with your institution or with there are some databases, the sites. Prospero is one. So when you register, you get a number. And that is a must for publication for a systematic review in a high impact factor journal. So you can even register the protocol. So for systematic reviews on human studies or animal studies, Prospero, that you can use it. And completed reviews should not be registered. It is a bit risky. So remember one thing, that Prospero will accept it only if there is a related outcome. Then they will accept the registration. Prospero does not accept. What it does not accept? Any systematic reviews without an outcome of clear relevance to the health of humans. Of course, scoping reviews are not welcome. And literature reviews that use a systematic search or systematic reviews assessing sports performance as an outcome, or any review where the quality of reporting is being assessed, and simple critical appraisals, those things may not be acceptable. So now the trouble starts. If you are not able to enter the Prospero, what do you do? So there are other alternatives to it. And if you see in this table, there is one research registry, one in Plessy. So all these are available, and sometimes you may have to pay. So the cost is written below here. This is one of the review in which you can see the registration is marked here. The protocol was registered. So that has been highlighted here. Can you publish your systematic review protocol? That is another interesting question. And if you look into this, there is the journal, which is again under Wiley. So a protocol can be published. Systematic reviews. This is what the Biomed Central, which is now a part of Springer Nature. So they say that you see their aims and scope on the site of the journal, what they flash, that all aspects of this design, conduct, reporting, they specify the things which are needed here. Last line, at this time, systematic reviews does not accept reviews in vitro studies. That is important. So what are the resources you need? Well-defined and clinically relevant research question. That is the first thing. Now, this is very important. Many people, they have certain things in their mind and they choose the topic. I would say that choose a topic where you don't have to surf much literature and you are left with very few articles with easy search. But if I pick up something like related to insulin and diabetes, I will have thousands and thousands of articles. A team of at least 3 persons, 3 or more. I happen to review one manuscript where a single person wrote it. So from there itself, I know that this will be full of bias. Guidance from experienced authors. This is very much essential for any type of review. So those who have published earlier, they join as the co-authors. You have higher chances of acceptance because they will give the expertise. Time to go through all the literature. These days, we see that even some of the lecturers, they do not know how to serve the literature or how to track the articles, what are the sources. So I believe that if we train everybody, then those lecturers who are the supervisors for the students, they will train them accordingly. So after a few years, say the next generation comes after a few years, and then you have everybody who is competent in literature surfing. Access to all articles identified. Through your library, you can have, there are some sources which are legal or illegal. The students know all these things. More than that, if you have a team, so if your university has access to a particular publisher and the other colleague from overseas who has access to other publisher, you can exchange. So the last and important thing is APC. APC is a big headache, and this is what is the main hindrance now. So I would say that all of you develop the skill of reviewing articles, because if you review, you will get vouchers. And that's what I do. I collect my vouchers and use it for my publications. Reviewing helps you to develop the critical thinking. There are many supervisors who have never reviewed. So sometimes when they come up with some questions which are a bit crazy and it doesn't look nice in front of a third person who is the external examiner or something like that. And I have seen some students in PhD Viva, they get through easily because on the Viva table, they put their publications that they have already published the paper. And the external doesn't open the mouth because it has been accepted in a high impact factor journal. So APC, you can request the journal that the first author is a master student to waive off at least 50%. So that is one thing you can do, or use the coupons. So what are the steps in crafting a systematic review? First, define your research question. What is your research question? Then clearly the inclusion and exclusion criteria should be specified. How the literature search was done, which studies were selected, quality assessment, how data was extracted, summarizing of the data, and the last part is discussion and conclusion. So think of an interesting question. Example, can tocotrienol prevent osteoporosis? Now in anatomy, it can be like there has been a debate has gone on for ages that whether this cadaveric dissection is important or not, whether virtual learning is important or not. So these are topics which are debatable. You can pick up a question which is very much debatable. So narrow down to a specific question. Now narrow down. So define the PICO in the specific question. The PICO is population, patients with osteoporosis, osteopenia. Intervention is tocotrienol. Comparator is placebo or vitamin E, and outcome is the bone mineral density. So under this heading of PICO, your specific question is there. So this will clearly define the research question. So the research question has to be relevant, clinically, and interesting. Look for similar systematic reviews published. Yes or no? Go to the Google search and do the surfing. If 3 to 5 years, not many studies have been published, you can pick up. But somebody who has published a review maybe 2 years back, 1 year back, don't venture into that topic. So if more than 5 years, many recent studies in between, proceed and provide justification. This is very important. The editor or the reviewer will say that similar studies were done. So what is new in this? So this is one of the review which was published here. Now the research question changes with initial literature. Can soy prevent male osteoporosis? A review of the current evidence. Now some of the titles sometimes is with a question mark. So if it is a question mark, means it is either here or there. But if it is a clear cut something is there, you cannot put it as a question mark. So if you see on the from the top, RQ1, can soy consumption prevent osteoporosis? Can soy consumption affect bone remodeling? And the RQ3, can soy consumption affect this male osteoporosis or not? So this is how you can identify the areas. The following research questions which can be appraised here. So how is the performance of osteoporosis screening tool in identifying patients with osteoporosis? What are the effects of vitamin D on the immune system? How does a pro-inflammatory diet promote the development of Alzheimer's? And this is what I was talking, a lot of studies on the hyperglycemic and the hyperlipid condition lowering drugs, they have been done through systematic reviews and the outcome is being used. So can statins prevent the occurrence of long-term COVID-19? Do men suffer from more severe COVID-19 symptoms? So these are the activities. What is your research question? You know, important thing, how does caffeine affect medical students? So for cognitive performance, maybe. The other topics are laid down here. I will not go into details of all this. Say number 5, does acute sleep deprivation affect short-term memory? So sleep deprivation before the exam is very common. So you can do in the undergraduate students, those who are exposed to the preclinical subjects. Inclusion and exclusion criteria. Be very clear which are the articles you have chosen, whether it is in English or French or Chinese. So we write there only English articles were chosen. Types. Usually we will not pick up all these case reports, letters to the editor, and also conference proceedings and all. Time frame. All these things have to be clearly specified. So if you see the hierarchy of the scientific evidence here, the highest one is the meta-analysis and systematic reviews, and the lowest one is case reports, opinion papers, and letters. So that is the triangle which is shown here. So follow the PICO, as I said earlier, that PICO. This is an example here which you see the inclusion and exclusion criteria clearly stated with Roman numbers 1, 2, 3, 4. Now in many of the studies, even in original studies, people do not highlight all this inclusion and exclusion criteria in detail. So those are the weak areas. So what was your inclusion and exclusion criteria? And then which are the search engines you used? What were the keywords? And what is a Boolean operator? Let us look at this. So databases, as everyone knows, you have this PubMed or Medline, Scopus. WOS now is owned by Clarivate Analytics, Cochrane, and CINHL. Of course, DOAG is there, that gives the number there. Now, if it is a commercial publisher, then Science Direct, Sage, Wiley, Springer, Nature, Biomed Central, Hindawi, you have Wolters Kluwer also. So these are all the publisher websites. Now you see what is the university subscription is there for full access or not. If not, then you try to write to the author and get the full article. And please do not upload your published article in ResearchGate if it is not there in open access. People have encountered the problem starts with the legal aspect. So do not upload in ResearchGate if it doesn't have open access. Keywords are very important. You choose the keywords from mesh. Sometimes people write phrases and those are not the actual keywords. So keywords should be only those which are picked up by mesh. Now the type of the study, quantitative or qualitative. So in this quantitative, you have these variables, factors related to the phenomenon. That is the theories for the foundation of the study. And qualitative, that is the major concept. So accordingly, you will have your methods. Now coming to this part here, the way how these studies are filtered. So you have, if you see on the top, three components which you see, A, C, B. So here, the C which is coming will have the articles with both search terms A and B, they will be selected. Or A plus B plus C. Third one is A not B equal to A minus C. That means only articles with search term A minus those with B will be selected. And the fourth one is A and B or C. These are some of the ways how the articles will be selected. Now you have to use special symbols with different databases. So if you see the symbol here, this means exact phrase. Example, bone density. Inverted sign is the sign is shown here. So the result is exact phrase is bone density, not bone and density. So it is a complete word, bone density, exact phrase. This is truncated. So therap. And if you give therap command, then it will catch therapy, therapist, all this. Now there's a question mark here with the EPSO host, and that is the wildcard. And here, say for example, the mark asterisk mark is here. That will catch both women and women. Then there is another one, wildcard here. You see the mark here, which will catch both humorous and humorous. So most of the search engines, they will catch with the one symbol you give in between the words. So now the key concept of the research question example, you know that what are the key concept of MESH or the keywords. Usually pick up the keywords in such a way that it helps the reader to filter the article when you have published it. And if you use the same keywords from the title, then you may be giving less choice, the less range of choice to the reader to access your article. So give a more range. Title will have different words, keywords different. The synonyms with these Boolean operators is again, one is like you use the word or. Tocotrienol or vitamin E or tocochромanols, like bone mineral density or bone density or BMD, all this. You can use the word or also. So frame all the keywords in such within a bracket. You can have this or word in between, combine them also. And some people use different mark like semicolon or plus, like what you use in the PubMed also. So discuss these keywords. If you do not discuss with your seniors or the senior supervisors or co-authors, then you might be missing out something. And or all this also you have to use with caution. So do not apply any kind of filter during the search. And the results from the major search engines, there is a PubMed, Scopus, Clarivate, they do not differ much. And if it happens, then check the filters. So now the search string and performing the search. So the mechanism here now, you have something called Covidence. This software helps you to write the systematic reviews. Reference manager is there, and you can go ahead with all these things. Then the authors who did what. So we mask the identity and we write A did such, B did such, like that. So have a trial with Covidence website. Now it is paid, but you have a trial period and you can get to know. So all the authors need to sit in front of a screen and the reference have to be tabled out. And the authors, they vote on the spot to decide which article to be taken. So that is a clear-cut Prisma chart, how you filter out the articles. And this is a must for all systematic reviews. So you see how detailed search has been done here. After the direct search, then duplicates were removed. Then the number of the title and abstract were screened. Then exclusion criteria. Then the number of full text. Then exclusion criteria based on the criteria which you have specified. Then reference tracing and final inclusion. So that is how the systematic review is done. At the end, you keep your EndNote. This EndNote will help you to screen out the duplicate references. There's a must. So this is a screenshot how the EndNote has been used, and it is really beneficial. So all the postgraduate students, they should be taught with the EndNote, and also the lecturers. They help you to do the referencing very fast. So this is how you can check the list of the references and none will be duplicated. So those who are writing thesis, the students also, they can check all the references. So this is all the EndNote, which is showing in detail how it was searched. So things can be excluded accordingly. Now the research question, the search was performed and search results got, then screen them together. Now what may be the bias which the reviewer or the editor usually they will ask. So these bias may be in data collection, data analysis, data reporting, and publication bias. So bias is deviation from the truth, and sometimes it is intentionally done or unintentional. And error. Now, if you have an error in the systematic review, it can be challenged and the article may be withdrawn, retracted later on. So that is very risky. So why does bias occur? It is not randomized. These samples are unrepresentative. And sometimes the disease is hard to diagnose or classify. This happens in data collection process. During analysis, there is a pressure to publish. So people might be hurrying up. Hidden interest of the authors, sometimes for commercial reason or for fame, something like that. During reporting, pressure to get the significant results. Students are always, they try to manipulate. And sometimes they will manipulate to get the p-value significant also. You should be very careful as a supervisor. And of course, there is a pressure to publish. So these are all the bias assessment tools for different type of studies. First, the RCT. So they are some of the tools which are shown on the right side of the table. Then observation studies, then animal studies, and in vitro studies. So they can be assessed. So here you can see the checklist here. Checklist for different type of studies, like for case reports, case series, cohort studies, all this. So the tool is there. This is an example which goes with the RCTs. That is called as JBI Critical Appraisal Checklist for RCTs. So now here in the presentation for the manuscript, this is how we put it according to the authors here, which you see. And if you see the plus, minus, and all this, they will clearly show whether the bias has been done or not. Data extraction, use the Excel sheet. MS Word file also can be used, Google Doc sheet, the Google Doc document. And the items which you need, the authors, interventions, study population, methods, and what were the results, everything in detail. So all these informations are gathered in the Excel sheet like this. Now you see how systematic it looks if you have a look from the left side to the right side. So everything there in the table, and then it becomes easy to interpret. This is the Google form, which you can also use, which you can share with your co-authors. And people know that what you are expecting, what you need to do. And in a Google sheet, you also lay down all the things from left to right. You can see all the aspects. So this is how the authors have done the studies. And on the right side, the column, you can see the notes. This will also help you. Now that is again the summary of the diagnostic values on the right side. So you have all the different things like cutoff, sensitivity, specificity, AUC remarks, all this. So it takes time. So you can use abbreviations while you are having the results, summarizing the results. So all the things here in the tabular form, you have tabulated it, focus on the changes, and now you plan your systematic review. Research question, what will be your search? The keywords, the Boolean operators, how you include and exclude, what are the criteria for this inclusion and exclusion, databases which you are going to take, then screening. Prisma will give you foolproof the steps, bias tool which you are going to use, and proposed evidence table with exemplary studies. So these are all the things. Now summarizing the data. So you have this statistical tools. If you want to use it in the meta-analysis, it is a different story, but systematic reviews. Now you analyze it, describe the search results, the characteristic of the studies, and what is the outcome. So that is very important, the outcome. Now coming to the discussion. In the discussion, you have these findings ready, and then you have to also discuss the limitations of the review. And many of the authors who write even original articles, they forget these limitations. So those you have to highlight it. Limitation is clearly stated here. You can see limitations of the field. Limitations of the field will bring out the novelty in your work, and limitations of the review is the thing which you are humble enough to admit that this may have some limitations. So conclusion, you have the summary and the suggestion A. Now this is very important. Even for an original research study, as an editor and reviewer, I see many of the authors, they conclude based on their results, but they do not give the implications of those results. So if you have done an anatomical study also, such and such may be important for the surgeons. People write like that. In what way? Is it for the clamping of the artery, or is it for the incision? So you have to state the implications clearly in your conclusion, and not rather end the story by only concluding with the results. Are more studies needed in the field? Of course, science has to progress and you cannot stop there. So people say further studies are needed with larger sample size. Of course, now with limited sample size, if you are doing an original study, the first question which the reviewer and the editor they ask is, how did you calculate your sample size? Some people say we saw in 50 cadavers, we saw in 100 cadavers. But what was the rationale behind that? What was they ask even the power of the study now. So it's very important that whatever sample size you have taken, that is good enough to accept that this outcome will be acceptable in the scientific field. So people admit, yes, my population, the subject size was less. So with larger sample size, it may be different. So here the summary is there and recommendation. Public health related articles, they go with good recommendations at the end, near the conclusion. When you're writing, you write with recommendations. So if you're writing any review article or original article on anatomical aspect, give the recommendations that how this these things can be incorporated by the institution or the government, the issues. So we had published this review only 2 years back, I think, yes, 2022, and this is on the virtual reality, and that is for treating the mental health problems. It was a systematic review, and it has got 19 citations in Scopus to date. This was an interesting article, and the first author happens to be a master student. So he's a crazy guy for all these electronic things and all. And then we devise the template, and we ask all the authors to come in. So that is how you can plan a systematic review. These are all students, first author, second or third author, all are students. And they came out with an interest to write a systematic review. And we said, why not? You take it from the clinical trials which have been conducted, and gum arabic, that is used as a natural product which can be used as something like more of supplementary or alternative medicine. And they published it in Biomolecules, and this is a quartile 1 journal. So there was a monetary reward also for this. So we have even the team with the undergraduate students who write systematic reviews. So those were all the things which we have done over the last few decades. So if you have any questions now, that would be a pleasure to answer those questions. Yes, please. Thank you so much, the audience and the organizers, chairpersons.
Thank you so much, sir, for that brilliant session. Now the floor is open for discussion. I request the chairpersons to lead the discussion.
Good evening, Dr. Srijit.
Good evening. Yes, go ahead, please.
Wonderful presentation. Today's evening is really a feast for scientific acceleration of knowledge.
Thank you, madam.
It's a pleasure to be here. And like Dr. Richard and Dr. Srijit, you have really unfolded so many areas. I'm sure those who have followed today's celebration of World Anatomy Day, they have been much benefited. At least I can say I have recapitulated, learned a few more, and have a few questions also. Dr. Srijit, I really thank you for opening up this area of knowledge, innovation, and of course, publication and research field. If I have to just ask you, it's my question basically, I'm not giving any opinion about it, that suppose next 5 years, if we look ahead, what are the areas you feel that AI may take over? Because till date, we are concentrating, you have already exposed so many fields of research and its analysis and the literature review, applications, way forward, everything. Now, which are the prime areas you feel that AI may take over in the future? Dr. Srijit, over to you.
Thank you, madam. The thing is here, AI is a new entity. Now, why we are using the AI and what can be the benefits, whether it outweighs the disadvantages or the negative things. Now, I, as an editor and reviewer, also as an author, I have reservations against this AI in medical writing. Students are using it to write the thesis, sentences. So now we have a declaration which has to be given by the author, and many of the students also, they have to declare when they submit their thesis that they have not used AI. So for patient care and all, it is different thing, where you reduce the manpower or you use the machine learning, but it has got its drawbacks in medical writing. Clearly, we have to sign the document as an author for all these high impact factor journals like in MDPI that AI and ChatGPT was not used. Now, to create a data bank, AI can be important in anatomy. Say, for example, I was a visiting professor for Chiang Mai University in Thailand. If you go to their anatomy museum, say a particular bone like the femur, they will have more than 1000 real bones. So all this data, if it is, as long as it is captured in a data bank, which the anatomy department can hold it, and that can be used later on, like, I know this is my data bank. Now this goes with the forensic as well. There are many studies which anatomists are doing on the bone or on the soft tissue. Say, for example, the dermatoglyphics and all in a different population. So those can be stored and you use the AI for identification. We are doing a study now with a specialized camera where you can visualize the dorsal veins on the veins on the dorsum of the palm. So if I have already published studies that these are the classified types. Now, if I put it in the AI and I use it in a definite geographical location or in a country, so that can be like your biometrics, which you are using. So anatomy goes a bit with forensic science, and they can be used for storage of the data like that. But for coming for the teaching area, now the teaching part, where you have all the virtual learning and all these things, students, they have they are adapted to different types of learning in different set of infrastructure. The only question here is the budget, whether the budget is there or not. If the budget is there, yes, the universities can go with that. It's like when the anatomy came into practice, anatomy was not possible for every university. Now suddenly the anatomy is out and other 3D learning methods have come in. This is a commercial market, and whatever is sold in the market with the opinion that it will help the students better. But at the end of the day, you see that every country is changing its curriculum, its way of infrastructure. So we are not always happy with that, So changes are going to come in. And AI, yes, it has got plus points. I won't give demoralizing facts, but the negative things are also there.
Thank you so much.
Most
Because
welcome.
when we are utilizing the power of AI or ChatGPT, there is yet to be done a lot of bioethical issues.
Right.
It can be patient related, research related, or even academics, publication, and everything.
Right.
AI, as you said, I really appreciated the utilization of AI for data banking or observatory. We can easily create an observatory. And Dr. Srijit, I'm sure you are one of the pioneers in innovations. So it won't be, because if you see Southeast Asian countries, they hardly have any observatory regarding anthropometry,
Right.
where we can easily utilize the AI and we can have our data. We can have our own data, and it can be created. And I thank you, Dr. Srijit, for highlighting the power of AI, highlighting the Boolean operator. It was extremely interesting because I was not aware of it. And the rest, of course, the Prospero and other things. I'm sure those who have followed your speech has been much benefited. And today's evening is an evening for world anatomists, and it has been celebrated in a true sense. And I give the floor to others for asking questions. Thank you.
Thank you, madam. So I think all the participants, they can form their own team. And as madam, you have suggested, it can be like between different institutions across different geographical areas. And that will make anatomy more stronger. Like you have the studies which are published in Lancet, it is multi-institutional study, but those type of studies we do not find in the field of anatomy. So if it can be planned and authors can keep on coming, and we have a big study. Yes, please. Any questions?
Hope we don't have any more questions, sir. So once again, thank you. As a token of our gratitude, we would like to present a virtual recognition to Dr. Srijit Das. I also would like to extend my heartfelt gratitude to our esteemed chairpersons, Dr. Soumya Chakrabarti and Dr. Sohinder Kaur, for their valuable contributions. So as a token of our gratitude, please accept our virtual recognition.
Thank you so
Now
much.
I'd like to invite. Sorry. Thank you.
Yeah, thank you so much. I would like to express my gratitude to Dr. Sivakumar, Dr. and Dr. Ravi for not only organizing this day, for considering me as a chairperson, and I'm extremely happy. I learned a lot. I'm very thankful to Dr. Richard Tunstall and Dr. Srijit Das, who happens to be my friend also. And I'm also grateful to Dr. Rose for beautifully conducting the session. And this proves that learning is dynamic and anatomy is not cadaver. So anatomy is much beyond. And these days, we not only talk about evidence-based anatomy, as Dr. Richard has already highlighted. I find Dr. Srijit highlighting the various aspects of the research along with the application of AI and dissemination and way forward. I'm very grateful for this session because learning is dynamic, flexible, utilizable, and it's a day-to-day practice like medicine on patients. So I thank Dr. Ravi especially because he was the one who contacted me, and I'm very grateful to him and to the team SOCA and NGCA. Thank you so much. Have a pleasant evening.
Thank you so much, madam. Now
On
I would
behalf,
like,
Dr. Rose, 1 minute.
yes, please continue.
On behalf of Society of Clinical Anatomists, I am grateful to the chief guest, Professor Saman Singh sir, and guest speakers, Professor Richard Tunstall, Professor Srijit Das, for accepting our invitation and being part of our World Anatomy Day 2024 celebrations. So we are really benefited by the guest lectures by Professor Richard Tunstall and Professor Srijit Das. We have to thank our chairpersons of these sessions, Dr. Soumya ma'am and Dr. Sohinda Kau. Thank you so much to all of you. Thank you, one and all.
Thank you, sir, for the wonderful words. Now I would like to invite Wolters Kluwer's team to present their ebook platform before we move on with the results of various competitions held. Over to you.
Well, thank you, ma'am, and thank you for giving us the opportunity to showcase. As Dr. Richard as well as Dr. Srijit Das has touched upon the usage of AI, for the future generation and for the future learning and testing methodologies that we have to use for our students, and also adopt it as a faculty, a respected faculty of all of you. So let me present a small presentation. I'll just not take much time for this. So let me just share my screen to all of you. I hope my screen is visible now. Hello. Hi. Dr. Rose,
Yeah,
Rose,
actually, the screen is showing advancing anatomy. Is that the one you're sharing?
No, wait. I'm just sharing the screen. Okay. Now, is it working now?
Yes. Now it's working.
Thank you, ma'am. Thank you so much. So as we all touched the base upon, the AI, the usage of AI in the medical education. So just give you a little background of Wolters Kluwer, also known as Lippincott, Williams and Wilkins. So recently we have produced a new platform, ebooks platform, which is Lippincott Medical Education. So just to begin that, I give you Wolters Kluwer on a single page. Our tagline is when you have to be right. And we are serving in over 180 countries and operating in over 40 plus countries. We have over 1,000 employees worldwide. Our revenues are around 5.6 billion euros. Our purpose is to help professionals deliver in deep impact when it matters the most. We are at 93% of Fortune 500 companies are served by Wolters Kluwer. In gender diversity, we are 2% of male and 40% of female. As a publisher or as a content provider, we have our values, which is like focus on customer success, make it better, aim high and deliver, and win as a team. So if you look at our portfolio, we are there in almost in medical education, I would say. So we are basically in categorically medical education. We are very much there in research, and we also there in evidence-based solution. So for example, the education point, we have produced a new platform, which is Lippincott Medical Education eBooks platform. Just to give you a glimpse that this platform has already been adopted in some of the key institutions across country, like KMC Manipal, AIMS Jodhpur, PGI Chandigarh, SRHU Dehradun, RGUHS, and AIMS Patna. Apart from the platform, there are many products that we have which are being, adopted by some key institute across the country. So some fact I would like to, showcase here, like in 2023, despite rapid growth in the number of medical colleges, Indian medical education faces a stark misalignment with current healthcare demand. The Indian medical colleges have expanded their seats by approximately 56% since 2014. And yet there remains a significant gap in quality and relevance to medical information needs and the insufficient faculty development programs. Like addressing a mob, faculty-student ratio in medical college is not ideal and is hampering trainings of doctor also. I think we all abide by that and we know that. So why, but why us? So through us, because Lippincott or Wolters Kluwer is one of the largest content provider, globally. So we have with us a reliability, credibility, and alignment with curriculum, with customizable pick and choose option. Then we have our products which emphasize on CBME objective, which include learning objective, teaching methods, and assessment. Then we have plethora of gold standard titles. We have over 300 plus ebooks, which includes Lippincott, perennial sellers, some Washington manuals, and Kaplan series. And it's again, as I mentioned before, it is powered by generative AI. So you can easily, with the help of AI, you can generate summaries, interactive assignments, citations. And it is also IP and remote access mobile. Like for example, so that you don't need to have an internet to access your books, your EPUB ebooks. You can also access them offline. And it's a one-stop shop. Like faculties can share information, task, and view usage monitoring of the student, that how the student is referring to the books, how often it is referring to the product that he is. So this is a platform called Lippincott Medical Education. So I'll just play a small video to you, which will actually show you what does it take, like what it is all about. So as you could see that, it has got so many features, and just to tell you, and just to debrief you about the features again, like it has user-centric design. It has got a digital bookshelf, seamless collaboration. Like for example, this platform can also be integrated in your local LMS or institute system, very easily. It has got some smart study tools that it has got. Then advanced research, advanced search, detailed analytics, and customer support is also provided with these features. So here are some new features, which is when I talk about generative AI. So what you can do is actually, by any topic you choose within the EPUB version of a book that you have, from that particular topic, AI will help you to bring out the summaries, the multiple choice questions. You can select the test, you can share the text with your subordinate or a colleague. You can generate some study notes for yourself. You can highlight the text. In fact, also you can, use and listen to the test in multiple languages, like for example, maybe English, maybe some different language altogether. So it has got a lot of interactive and tools with the help of AI that can be used on the platform itself. And also it gives you a market leading dashboard. For example, you have 200 students in your class and you have taken the product and given it to the students and all. So you can actually use the usage, that how students are referring to this product in a very dynamic level. To also get book title analysis in beta testing, which is still in the process, that how do we use the book. So which chapter, which topic the student is referring to. This is also we are working upon it. So it soon it will be available. So more on product. There are some products. Also, you can add some YouTube videos, and share with your colleagues, within your institute or maybe out of the institute also. This is the one-stop shop that we have, for the platform. Thank you very much. And what the offer that we have today is that we are also providing the free demo for 30 days, free trial demo to all the institutes who would like to have this product there in the institution library. So in the response form that I have circulated, please share your reviews. And also, if you are interested to have a demo in your institution, please give us the feedback. Our local representative will be in touch with you and, set up a trial demo in your institutes directly. Well, thank you so much for this time, Dr. Rose. Please go ahead. You can go ahead with.
Okay, thank you, Mr. Ravi. To inspire our young minds and faculty to express their thoughts, we organized an essay competition on the thought-provoking topic, Navigating the Storm, Analyzing the Impact of Recent Controversies in NEET Entrance Exams on Students and Medical Institutions. The response was truly overwhelming. I would now like to invite Dr. Ritu Segal, Professor of Anatomy at AIIMS Delhi, to announce the result. Over to you, ma'am. Ritu, ma'am.
PowerPoint.
Sure,
No,
sir.
please
I'm
wait.
going to try to.
Please wait. Please wait. Please wait.
PowerPoint of the results, please.
Can I have Dr. R. Chitra, Professor of Anatomy, Siddhartha Medical College, Vijayawada?
I'm here.
Yes, ma'am. Can you please share your thoughts?
Good evening to all. I feel so happy to join you in this evening of World Anatomy Day after the scientific feast by our professors Richard and Srijit sir. And I am privileged to be one of the judges for this essay competition titled Navigating the Storm, Analyzing the Impact of the Recent Controversies in NEET Entrance. It was so good that so many faculties and students participated in the competition, and it was very tough to select the good ones because many of the essays described the storm very efficiently, and marks were given following that four parameters: content, presentation, and coherence, and grammar. And we have decided the best essays for the faculties and the students separately. I hope Dr. Rose will announce now, and I congratulate all the faculties, faculties and students. Thank you, the organizers, for giving me this opportunity.
A special thanks to Chitra ma'am for her valuable feedback. Once again, congratulations to the winners, and we would also like to honor the judges with certificate of appreciation.
Sports right. नहीं हमने उनका लोगो हो जाएगा वो हो गया होगा मैम एक हमारा वो चल रहा है मुझे कमेंट है एक मैम वो वर्ल्ड एनाटॉमी देखा ठीक है वो पता कर लेना जो करता है वो लग गया है That's right.
To provide a platform for the creative minds within our fraternity, we announced a cowpage competition for faculty and students. This time, the response was fantastic. I would like to invite Dr. Reha Mahajan, Associate Professor of Anatomy at AIMS Demo, to announce the result. Over to you, ma'am. Reha, madam, are you there?
Hello.
Yes, sir. I'm just showing it. Just give me a second.
Rose ma'am. Hello.
Yes, Dr. Pushpa.
Please announce the results, ma'am.
Yes, we have the results of cowpage. So once again, congratulations to the winners. Third prize, we have V. Vishwas Verma, MBBS AIMS Mangalagiri. Second prize, Shashwant Singh, Junior Resident, Uttar Pradesh University of Medical Sciences. And first prize, we have Rajneel Patel, MBBS, Bharati Vidyapeeth Medical College and Hospital, Sangli. In the faculty category, third prize goes to Dr. Jyoti Sharma, Senior Resident, Uttar Pradesh University of Medical Sciences, Sci-Fi, UP. Second prize goes to Dr. Raghavi N, Senior Resident, ESIC Medical College, Chennai. And first goes to Dr. Minu Bedi, Professor, RIMT Medical College, Mandi, Gobingar, Punjab. And we'd also like to honor the judges with certificates of appreciation. Dr. Shalini Kumar, Professor and Head, New Delhi. Dr. Reha Mahajan. Dr. Chetan Sani. Dr. Osmol Xavier. Dr. Shivani Dingra. And Dr. Pushpa NB. So before I invite the word of thanks, I would like to request our Editor-in-Chief to share some concluding remarks. Over to you, sir.
Rose, I am at the signal. You can continue. After the vote of
Sir?
thanks, I can.
Okay. So
Rose
I
ma'am, please ask, hello, please ask
Yeah.
Ritu ma'am whether she is able to talk now.
Okay. Ritu ma'am, can you hear me? Hello. Ritu ma'am, Professor of Anatomy at AIMS Delhi. Ma'am, are you online?
I is having some problem itself.
Yeah.
Please ask her.
Okay. For the time being, I think we can move with the vote of thanks. Now I request Dr. Shivani Dingra, Assistant Professor, Department of Anatomy, Government Medical College, Kannauj, to deliver a vote of thanks.
Dr. Rose, can I speak?
Yes. Yeah, sure, sir.
Okay. So, good evening, one and
Now
all.
I've been able to unmute myself. Before this, I was not able to unmute myself. I'm so sorry.
Okay. Dr. Ritu ma'am, please go ahead, ma'am.
I think the result has been declared.
But you can
Congratulations
give
to
your
all the
comments, ma'am.
winners. Congratulations to all the winners. The topic was very topical, extremely well selected, because right now this is a matter of, hot contention, a lot of discussion in the media, as well as among people, among groups of students in the faculty across the medical institutions of the country. So the topic was extremely well selected. It was about the impact of the NEET controversies, and it was worded very picturesquely, navigating the storm. Now the essays, some of the essays, very few of them, actually did justice to every aspect of the topic, which was not only the impact of the NEET controversies on students as well as medical institutions of the country, but also how we are going to find solutions, how we are going to navigate this storm of controversies. A very few essays actually gave equal amount of importance to each aspect of the topic. Most of the essays did outline the impact, the actual controversy, what is NEET, what is NTA, and the actual controversy very well, because this has been discussed widely in the media, and even the impact on the students, on the mental health of the students, and on their future career prospects, as well as on the quality of students we receive at the premier institutes, notably the AIMS institutes of the country. All that was outlined well. But very few essays really gave us how we can navigate this storm. So I'm sure a couple of the essays which were actually authentic were selected for the prizes, and these essays actually gave equal weightage to each aspect of the topic. So I congratulate the winners, and I'm glad this essay competition brought forth diverse views about how we are going to approach the problem. And congratulations again. And it has been quite illuminating to have attended this afternoon session of SOCA. I was particularly interested to hear the lecture of Dr. Richard and also of Dr. Srijit, who is an ex-colleague of ours. But Dr. Richard presented a fresh outlook on how we can actually approach anatomy. I don't absolutely agree with his views in the sense that I still feel cadaveric dissection is the cornerstone, is actually the gold standard for learning anatomy. But other ways to learn anatomy, those were detailed very well. So I was not able to put forth my views earlier. I also had a question for him, but now I think the time is over. Maybe some other time. Again, congratulations to all the winners. Thank you.
You can write to us your question. You can
Thank you so much,
mail to
ma'am.
us. You can mail to us, ma'am, your question. You can write to us at ngc.soca@gmail.com.
Sure,
We will
sure.
convey it to the speaker. And thank you so
I
much,
will.
ma'am, for your valuable inputs to all the judges of the
I
both
will.
essay
Thank you.
competition and cover page competition.
Thank you.
Yeah, welcome.
Now over to you, Ravi sir.
Good evening, one and all. So thank you so much for the wonderful participation from the delegates across the country, you say. And now as we draw this enlightening celebration of this World Anatomy Day to a close, you can say, I would like to take a moment to reflect on the invaluable insights we have gained and the, you say, the connections we have formed. So first and foremost, my heartfelt gratitude goes to our chief guest, respected Professor Sarman Singh sir, who is so busy still on very short notice. I requested sir and he gave means his acceptance to be the chief guest of this World Anatomy Day program. I'm really grateful to you, sir, and your inspiring words have definitely set the tone for this event, and your and wisdom have enriched our discussions and motivated all the anatomists to further our understanding of, you say, the research and how we can go ahead in the anatomy. Apart from that, I would like to say my heartfelt gratitude to the esteemed guest speakers, Professor Richard Tunstall and Professor Srijit Das sir. Thank you, sir, for sharing your expertise and passion. Definitely, as we heard from a lot of the delegates and even the panelists, the feedback about the your talks. So definitely your presentations have not only we can say that deepened our knowledge, but also sparked the meaningful conversations. We can say that will definitely resonate well beyond the today on. And our special acknowledgement to our chairperson, Professor Soumya Chakravarti madam, for their guidance and we can say the leadership throughout the sessions. And I really appreciate your commitment, ma'am, to fostering the dialogue and collaboration that has been really instrumental in making this event a great success. I'd like to extend our sincere appreciation to Mr. Ravi Shukla, team from the Wolters Kluwer. Whenever we have said you were always there to help us and to organize such academic events. We are really grateful to you, sir. And I must appreciate the two persons apart from the President, General Secretary, and the Treasurer. The Dr. Pushpa NB was the person behind all these activities from the, you say, the day we decided to organize this World Anatomy Day 2024, and she was very much instrumental. And at the last moment, because we were not available, I'm grateful that in the last moment, Dr. Rose accepted.
Ravi sir, you are not audible.
Not audible.
Sir, are you there? Sir, your voice is breaking. You're not audible.
Yeah. Am I audible? Hello. Hello.
Yes, sir.
Hello.
Now
Am
you're
I audible?
now you're audible.
Efforts taken by all the
Sorry, sir. Your voice is again breaking.
by all the judges. Yeah.
Sir. Okay. So your voice is breaking. Hello.
Rosa, I think there's a connectivity issue at his end.
Okay.
Please
Okay.
continue, Dr.
So
Rose, if I'm not audible.
okay. Okay.
Please
Thank you
continue,
so much,
Dr.
sir, for your valuable feedback. Okay. So now I request Dr. Shivani Dhingra, Assistant Professor, Department of Anatomy, Government Medical College, Kannauj, to deliver a vote of thanks. Madam, are you there? Dr.
Yes,
Shivani
I'm
Dhingra?
here. Yes, I'm
Yeah.
here.
Yes. Thank you, ma'am. Thank you, ma'am. Over to you.
Good evening, respected chief guests, guest speakers, chairpersons.
Dr. Shivani, you're not audible.
Am I audible now?
Yes. Now you're audible.
Good evening, respected chief guests, guest speakers, chairpersons, office bearers, and esteemed delegates. It is my great honor and privilege to extend a heartfelt vote of thanks for this webinar organized by National Journal of Clinical Anatomy under the aegis of Society of Clinical Anatomists in celebration of World Anatomy Day 2024. First and foremost, I would like to express our deep gratitude to our esteemed chief guest, Professor Sarman Singh Sir, former director and CEO of AIIMS Bhopal. Your gracious presence has greatly enriched this event, and we are truly privileged to have had the chance to hear your valuable insights and experiences. Your participation has undoubtedly elevated the significance of this occasion. It is also my sincere privilege to thank our distinguished guest speakers, Professor Richard Tunstall from the United Kingdom and Professor Surjit Dasar from Oman. Your expertise has added immense academic value to this event. We are also deeply honored to have Dr. Soumya Chakrabarty and Dr. Sohinder Kaur chairing the sessions. Your wisdom and guidance have been invaluable, and we are immensely grateful for your contributions. I would like to extend my heartfelt appreciation to our President, Professor M. Sivakumar Sir, our General Secretary, Professor N. Muthukumar Vel Sir, Editor-in-Chief of NGCA, Professor Kumar Satish Ravi Sir, and Dr. Pushpa N.B. Madam, Treasurer of our SOCA and Assistant Editor of NGCA. Your unwavering support has been instrumental in the success of this event. A special word of thanks goes to Professor Satish Ravi Sir, whose dedication, time, and passion from the very beginning have been the driving force behind the celebration of World Anatomy Day. His tireless efforts, day and night, ensured that every detail was meticulously planned and executed, marking today's event a remarkable success. We are also deeply grateful to our sponsors, Wolters Kluwer Publishers, for their generous support. Your contribution made it possible for us to deliver an academic event that meets the international standards, accessible to participants from all over the world. I would like to extend my sincere thanks to the wonderful team of judges for the essay and cover page competitions. Your careful evaluation of the participants' work is greatly appreciated, and we are thankful for the enthusiastic involvement of all the contestants. A special mention goes to Professor Viveka S. for creating the beautiful felicitation videos in a remarkably short amount of time. My heartfelt thanks also to Dr. Rosemol Xavier for her meticulous hosting of the webinar. Lastly, but certainly not the least, I would like to express my deepest gratitude to all the office bearers of SOCA, editorial board members of NGCA, reviewers, subscribers, academicians, authors, and well-wishers who have shown their love and support for this journal during the webinar. Your engagement has played a significant role in making this event a resounding success. Once again, I thank you, and I thank every one of you from the bottom of my heart. Thanks again. Over to you, Rose ma'am.
Okay. Thank you, Dr. Shivani, for those nice words. So thank you for joining us in celebrating this day of reverence and discovery. Let's all remain inspired by the elegance and complexity of the human body, and together may we deepen our knowledge and appreciation of this remarkable field. Have a great evening. Thank you all.
Thank you, ma'am. Thank you all.
Thank you, everyone.
Thank you so much, everyone.
Thank you, one and all.
So once again, wish you all a very, very happy World Anatomy Day.
Feedback link has been shared. The delegates, please fill it and submit.
Hello, thank you. Thank you all.
Thank you, sir. Thank you, sir.
It was wonderfully done. Thank you. Thank you, Wolters Kluwer, General Secretary, sir, Editor-in-Chief, sir, Chief Guest, and all the speakers. It was wonderful. Thank you so much. Thank you very much.
Thank you, sir. Dr. Rose, I'll keep this session on for the next 15 minutes because I think people might give us some useful feedback on the program.
Sure. So I'll be
Rose,
leaving. Thank you.
Dr. Rose, you did a very nice job. Very good.
Thank you so much.
Very good
Thank you.
comparing. Thank you so
sir.
much.
Thank you so much. Thank
Bye,
you, sir.
madam.
Thank you.
Bye, everyone.
Thank you.
So please post the feedback link.
Ma'am, I've already done.
It's already
couple of
posted.
I already do
Okay,
it.
okay.
You can do it. I'll do it again now.
Oh.
Also, ma'am, this link can be sent to your contact people also, maybe through WhatsApp and all, so that they can also get the link easily and they can get the form filled.
No, only here. Feedback form.
Okay, only here. Fair enough. So, ma'am, so I have posted the
Only
link
here.
again.
Oh,
I
yeah.
have already
Only
posted the
here.
link again.
Not
Sure, ma'am, sure. So I'll keep this window open, session open for the next 10 more minutes. So let them give their feedback on that.
Yeah.
Now, it was pleasure working with you all again. Let's meet next year.
Thank you so much, sir, for all your contribution.
Thank you, ma'am.
Thank you so much. Okay.
Thank you, ma'am.